Hi class, I hope that you're all doing well. In this video, I'd like to share with you some of the history of how mental illness has been treated, and I'd like to share with you also some important issues related to the treatment of psychological disorders. Before we get started, I'd like to give you a chance to think about what you think about some important issues related to the treatment of psychological disorders. So, what do you think? Many people who need some form of therapy do not receive any therapy. Do you strongly disagree? Disagree, neither agree nor disagree, agree, or strongly agree? Well, the correct answer is agree, although you may have a different perspective. What we know is that there are many people who don't receive therapy who really need it, and we're going to be looking at this in this module. And we're also going to be looking at some of the barriers to treatment. How about this one? The vast majority of people in therapy have a full-fledged psychological disorder. Do you strongly disagree? Disagree, neither agree nor disagree, agree or strongly agree. What do you think is true? What you'll learn in this module is that there are a significant number of people who receive treatment who don't have a full-fledged psychological disorder, but instead consult or go visit a psychologist or therapist or counselor because they want to have some support related to stressors in their lives. They may be dealing with major transitions. There are many different reasons outside of having symptoms of a psychological disorder that might compel a person to seek treatment. What about this statement? Although there are many variations, most people lie on a couch and talk about their distant past. So what do you think happens when people go to therapy? Would you strongly disagree, disagree, neither agree nor disagree, agree, or strongly agree? If you chose disagree, this is correct. Actually, there are many different approaches to therapy. And while some people will lie on a couch and talk about their distant past, many don't do this. And we'll be looking at these other approaches that are actually more common than this approach. And here's our last one. What do you think? Although there are many very different approaches to conducting psychotherapy, their success rates are pretty similar. Would you strongly agree, disagree, neither agree nor disagree, agree, or strongly agree? If you chose disagree, you're right. There are many different approaches to psychotherapy, and their success rates vary as well. We'll be looking at what makes therapy successful. In other words, what are the qualities of an effective therapeutic relationship? As you learned in the introductory video on psychological disorders, while early philosophers believed in a humane approach to treating psychological disorders, in more recent history, beginning in about the 12th century, we see treatments based on the belief that people who are mentally ill are possessed by evil spirits or that there's demonic possession. And this led to such approaches as exorcisms, as you see here, and trephination, like you also see here, where holes were made in the skull with a belief that evil spirits would be released, or that a buildup of pressure, which could be causing the symptoms a person was experiencing, would be released. As we look at the history of how people who've had mental illness have been treated, the treatment historically has been awful. They have been mistreated, they've been banished, and oftentimes people with mental illness were sent to asylums where the conditions were terrible, and a variety of awful treatments were forced upon them. Some people experienced what was called hydrotherapy. This was where warm or more commonly cold water, which was believed to reduce agitation, especially during manic episodes. This was used when people were experiencing mania, and they would then be submerged in a bath for hours at a time or sprayed with very cold water in showers. Asylums also relied heavily on mechanical restraints. They used straitjackets, waistcoats, and leather wristlets. Sometimes this would be done for hours at a time, and sometimes for days. Insulin shock therapy was another approach where high levels of insulin was injected into patients to cause convulsions and comas. This process will be repeated daily for months at a time, with doctors sometimes administering as many as 50 to 60 treatments per patient. In the mid-1940s, doctors would sometimes do what were called lobotomies. This required damaging neural connections in the prefrontal cortex of the brain. And it was done in this area because it was thought that this was the area that was causing mental illness. The problem, though, was that lobotomies changed not only the symptoms of the mental illness, perhaps reducing symptoms, but they damaged people's memories and personalities. About 50,000 lobotomies had been performed in the US, and this was mostly done in asylums. But believe it or not, it was actually in the 1970s that we still see lobotomies being done. Although it was rare, there were about 350 lobotomies done in the 1970s. But by then, medication began to dominate mental health treatment. And it's the advent of medication that began to compel some changes in the system, although it would take quite some time, as you're going to see. As these treatments were taking place, a very well-known woman in psychology and psychiatry known Dorothea Dix became a vocal advocate for the humane treatment of the mentally ill. This happened after she saw horrific conditions in a Massachusetts prison. And after that, she spent nearly 40 years lobbying both US and Canadian legislators to establish state hospitals for the mentally ill. So her efforts were very significant. They directly affected the building of 32 institutions in the United States. And she's accredited with creating the first asylums in the US to improve the treatment for the mentally ill. As psychiatric hospitals were developed, many hospitals became overcrowded, and they were dirty, and they were often abusive to patients. And many patients could have been safely treated at home, but they remained institutionalized. Patients were often institutionalized for decades, and there were limited treatment options. As this time went on, it was in 1955 that the first effective antipsychotic drug was introduced. And at that point, there were more than 500,000 patients in asylums. Now, by 1994, that number decreased to just over 70,000. So that gives you some perspective on the significant change that took place between the 1950s and the 90s as we saw the deinstitutionalization of people who were mentally ill. So starting in the 60s, institutions were gradually closed and the care of mental illness was transferred largely to independent community centers as treatments became both more sophisticated and more humane. In the last module, you learned about the features of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM, and it's in its 5th edition. So you learned about the DSM-5 and the important role it plays in the diagnosis of disorders. It was in 1952 that the first DSM was developed. And since then, we've seen revisions, as you learned in the last module. Now, I also have here for you some images from a very well-known movie from the 1970s that's called One Flew Over the Cuckoo's Nest. This is based on a novel by Ken Kesey. And in this novel, there is the main character who is telling of the inner workings of a mental asylum told by the view of one of the patients. I'd encourage you to watch the movie, probably better to read the book, but it's a very well-known film. And I think that it's this film, along with many other societal issues that were taking place at the time, where we began to see further changes. This contributed to a widespread understanding of many of the problems that were happening in mental institutions or asylums. And so many people, especially after that movie, felt that we should not have asylums and that people should not be hospitalized against their will. So there was the Mental Health Impairment and Rehabilitation Act of 1973. and it enacted laws to protect mentally ill people from being involuntarily committed. So involuntary commitment means that you're being treated against your will. And all of the patients prior to that who had lobotomies and electroconvulsive therapy treatments, they were being treated against their will. And people were up in arms about that because of the damage that this could cause. Today, if you want to have someone committed to a psychiatric hospital against their will, it can be very difficult. You have to prove that the person is in danger to themselves or others, and the person might pull themselves together in order to present themselves as not needing treatment before a judge. And then once you're an adult, you can refuse treatment unless you're court ordered for treatment because someone has been able to prove that you're a danger to others. If you're under 18, your parents can sign you in to basically any psychiatric facility, but once you're 18, you can sign yourself out. And while this has a positive side, this can also be problematic because sometimes a person may be very mentally ill and need treatment, but they may be very suspicious of others and they may not get the treatment that they need. So there was a deinstitutionalization that took people out of psychiatric facilities and moved them into the community and hopefully with family, but not everyone had family. But this didn't go as planned, or it wasn't planned out very well. They didn't develop community mental health centers that we still, many communities don't have today. And so there were not places where people could go to get treatment that they need. And so there were many people who didn't have housing, or there were also people who had very severe mental illness and they would not have the ability to seek housing or to seek the help that they need. And so this very unfortunately led to a very big homeless population. And there are estimates that about 26% of the homeless population has a severe mental illness. And these are people who aren't able to care for themselves and often aren't able to defend themselves. And they then become victims of beatings and being taken advantage of and have nowhere to go. Many people with severe mental illness are in the criminal justice system, and not for big time crimes like killings or anything, but more typically small crimes because they're trying to survive and trying to take care of themselves. They might, for example, break into an abandoned house or steal from a local convenience store. It's really a very sad state of affairs that jails are becoming what we could call the new asylums. It's estimated that about 30% of women who are in jail have severe mental illness. And that's not just depression, because most people in prison probably have some depression or anxiety, but we're talking about severe mental illness. And then when we think about police shootings and encounters, 25% have mental illness. Often when a family member is concerned about another family member who may be showing severe symptoms, they'll often call the police, and the police officer often has their hands tied. They're not able to get that person the help that they need. The person can't be committed to a facility. They might take the person to an emergency room, but they're then released again, and this then builds to or contributes to a cycle. And so there's a real problem in our society, and many may not realize how debilitating mental illness can be for some people, and how not treating with people with mental illness, not having them in longer term mental health facilities has an effect on everyone in the community. And it leaves many people homeless and destitute. I think that you've probably heard this before, and I remember hearing George W. Bush say this, that a society will be measured by how it treats its most vulnerable. Many people with mental illness are at our mercy, and this involves 1 in 4 fatal police encounters, 1 in 5 of all jail and prison inmates, and 1 in 10 of all law enforcement responses. So, what have you learned? You've learned about the history of the treatment of the mentally ill and important issues facing our society that are related to mental illness. What will you be learning about next? In our next video, you're going to be learning about various approaches to treatment. And you're going to be learning about what types of treatment or what approach to treatment seems to work the best. Until next time, please don't hesitate to let me know if you have any questions at all after watching this video or after reading your textbook. As always, I look forward to seeing you online.